Okay, so we're ready to go, and when you're ready, you can just go ahead and start the meeting and then direct me to establish a quorum for you.
Okay, thank you.
Okay, well, I'm going to go ahead and take the roll call to establish a quorum. Member Banks,
Present.
Member Hewitt, Member Rochelle,
Here.
Member Hanson,
Here.
and Member Wigglesworth.
Wigglesworth here.
Wigglesworth, I apologize. Okay, and you do have a quorum. Sorry about any background noise that you may hear. I'm going to go ahead and read the announcements. In compliance with directives of the county, state, and Centers for Disease Control and Prevention, this meeting is live streamed and closed to public attendance. Meeting procedures are subject to change pursuant to guidelines related to social distancing and minimizing person-to-person contact. To make a comment during the live meeting, you can sign up to make a public comment during a live meeting. Registration opens when the agenda is posted 72 hours prior to the meeting date. Dial 916-875-2501 to provide contact information. On the day of the meeting, callers will be contacted by phone and transferred to the meeting to make a comment on a specific agenda item or off-agenda item. Callers may sign up until public comments are closed for a specific item, respectively. If you'd like to submit a written comment, send an email comment to boardclerk@saccounty.net. Include the meeting date, the agenda item number or off-agenda item, and contact information is optional. Written comments are distributed to members, filed in the record, and will not be read aloud. And that concludes your announcements. So for your first item, it's going to be approve the 2021 meeting calendar of the Veterans Advisory Commission.
Do you have the dates, Rochelle?
I believe the clerk sent them all out to you guys.
Yep, I got them. Riggs got them.
Okay, and did you need me to read those dates off, or has everybody already reviewed them?
Can you please read them off to confirm?
Yes, I can. So it is recommended that the board adopt the following meeting dates for the calendar year of 2021. That's January 25th, 2021, February 22nd, March 22nd, April 26th, May 24th, June 28th, July 26th, August 23rd, September 27th, October 25th, November 29th. There will be no meeting in December, and then January 24th of 2022.
So we need a motion, correct?
Yes, to approve those dates.
This is Wigglesworth. I make a motion we approve those dates as so stated.
Rochelle, I second it.
Okay, so we have a first and a second. I'm going to go ahead and do a roll call vote. Member Banks?
Approve.
Member Hewitt? Member Rochelle?
Approved.
Member Hanson?
Approved.
And Member Wigglesworth?
Approved.
Okay, and your motion carries. So item number 2 is community organization presentations from VETAs and Blue Ribbon Commission for Women's Issues in Sacramento County. So I'm sorry, just a quick question. Who is going to be going first? Is it going to be VETAs first?
Doesn't matter to me, whoever you would like.
Okay, so we'll go ahead and start off with VETAs first. We have your flyer available. We can put that up on the screen for you.
Well, thank you very much. And also, I'm going to need some coaching in terms of, are you able to am I able to co-host so I can share?
Let's see. I believe you do have a share screen on your. Yeah, so when you look at your screen, does it show like a share screen anywhere on yours?
It does. So let me see what I can.
Okay. Yeah, so are you going to be ready to share right now?
Yes.
Okay. So we'll give you capability to share. So you should be able to just click that button.
Okay. There it is. Thank you.
You're welcome.
All right. I'm David Howell, and I'm with Vitas Healthcare and Hospice. And I really feel privileged talking to this group. Actually, my dad was a major at McCullen, where he met my mom, and then later on came me. And so anyhow, very good to talk to you, and I've enjoyed getting to know Rochelle. And she spoke to our psych social meeting, which is our meeting of chaplains and social workers. And we're looking forward to really having conversations. Last time I checked, we had 70 veterans on our list of patients. And of course, it's not just veterans, it's their families and their children. And Vitas covers a very large area, but it actually incorporates a lot of the areas that we have many military families and retired military families. And so we do have an ongoing admission of veterans, and we offer a wide range of services. But as anyone that has been involved with caregiving knows how laborious it could be to do that on your own. And so we offer that care at home in terms of providing a nurse, home health aide, chaplain, social worker. So we offer the expertise so you can be family to those that you're caring for. And Vitas, again, we have a really wonderful motto about every day is Veterans Day at Vitas, and we celebrate our veterans. We actually do an assessment from the very beginning of our veterans in terms of any type of emotional background or any type of trauma or any type of injuries, the particular campaigns they were involved with or wars. And so that helps us to get to know them. And also we want to get to know their families too. And actually that particular type of assessment we do with our social worker, our chaplain, our nurse, so we all get a picture of that veteran and their background and their family. And probably the most the particular staff you'll be seeing the most is our nurses. But again, we do have chaplains and social workers that I'll be talking a little bit more about. But it's there to really provide that support in terms of having that care. And also we go out to facilities and we go out to boarding cares. And this makes really a big difference. And this is one of our social workers. And again, Rochelle just spoke to one of our social workers recently and talked to our team of social workers. But the social workers are very involved with the veterans in terms of working with benefits. And one of the things that is going to be very helpful to us is working with Rochelle and having more opportunities for our veterans to understand aid and attendance. But there's other benefits out there too, and so we want to keep abreast of that. And so anything that we can do for our veterans and our families. Also, many veterans don't even know, which I've had a lot of experience. I came up as a chaplain and now I'm bereavement manager. But a lot of veterans don't know about the benefit of the national cemeteries. And I've done a lot with doing funerals in terms of at Dixon and also at Arlington, but particularly Dixon versus being closer. But the idea that is a wonderful benefit, and it just offers so much, and again, the military honors that are given. And then, as I was saying before, we have a team physician. We also have a medical director. We have nurses, home health aides, social workers, music therapists. And this is something that our Sacramento Valley office has been really blessed with. We have Brad and Rebecca, but they love doing songs for veterans. And so actually we produced a program for Memorial Day, and also they did presentations for Veterans Day. So very important aspect of who we are. And then also we have volunteers. Of course, right now the volunteers are by phone, but even with that, that's an important asset. And again, the chaplains come out and visit. And I think probably people have had experience with military chaplains. And our chaplains are very similar in terms of really not promoting any particular type of faith, but promoting a support for people both emotionally and spiritually. And this is Larry, one of our volunteers, and he's going to welcome you to Veterans Day.
Happy Veterans Day. My name is Larry J. Miller. I'm a retired Navy E-9 Master Chief. I'm a member of Team 274 out of the Fairfield office. Yay, Team 274! Just had to sneak that one in. I've been a hospice volunteer since 2008. It is an honor and a privilege to be with my clients, assisting them in having a good quality of life at the end of their life. I was the main veteran presenter for their We Honor Veterans program. We would set up a special date to do the presentation and invite their family and friends. And I would wear my full dress blue uniforms, same one that I retired back in 1984. Of course, it's kind of hard to breathe, but then I can still get into it. The veterans were very appreciative of the ceremony, and some of them even said this was the first time anyone had thanked them for their service. Sometimes the families would tell me before the ceremony that their loved one never talked about their service. But a veteran talking to a veteran always seemed to work, and the families were amazed. Sometimes if the veteran was in a facility, I would do the presentation in an open area, and other residents would gather around, and they would also clap for the veteran. On this day, Veterans Day, and every day, go out of your way to thank a veteran for their service. They will totally appreciate it, and you too will feel a sense of pride in your heart. Happy Veterans Day.
And also Larry is doing our Vet Cafe, which was the flyer that you saw when we were beginning this presentation. And we're very involved every year, particularly at Veterans Day, but we also do this when we have new veterans come on in terms of doing a pinning ceremony and a certificate, just welcoming them and letting them know just how honored we are to have them. And then I already mentioned the connection that we have with the National Cemetery. This is a picture of our Memorial Day presentation and just a little blurb about that.
Time to stop and pause and take thanks and pay our respects to the men and women who have fought and given their lives for our freedoms. Memorial Day brings to mind for me a lot of family traditions living back on the East Coast. It was the official kickstart for summer. There were many parades we had, and scouts and volleyball in the backyard, and a whole host of family traditions. So Memorial Day holds a special place in my heart in a patriotic way, but also in a way of family and time together.
Also, it's very difficult and end of life, and there's so many things that hit us when we are faced with a prognosis that lends itself to that. And it's difficult to talk about planning. And so that's something that our social workers and our chaplains are very involved with. And we can spend time and talk to the family and come back and bring materials and to make sure that people understand and are given the moment to think about their end-of-life wishes. It makes such a big difference to be prepared for your family, and we want to help with that. And then again, I mentioned the services that we do, and I'm in this picture in terms of helping out at the National Cemetery with our veterans. And so that's a great honor, and we thank you.
Thank you for the presentation. Does anybody have any questions?
Any questions? I just appreciate this opportunity. And again, questions about end-of-life care. I do presentations to veterans and community groups all the time. So if you have an opportunity where somebody wants a presentation, even about end-of-life planning in terms of advanced directives, in terms of facing challenges during COVID, we can do that. Also, VITAS offers at no charge to the community. I actually have people from Europe that have heard about this. We have bereavement groups. So we have bereavement groups, and also we have caregiver groups. So, and those are online in terms of Zoom and phone. So again, those are free services that we offer to the community. Any questions? Everyone's very quiet.
I'd like to. I appreciate what the presentation you just gave. And the only question, this might be a little bit off subject, but I'm a little concerned with using Zoom. With some of the reports out there that I've been reading, Zoom is not the best format to be using because of, and I'm not a conspirator or anything like that, but the Chinese connection. I would think enough that's out there. Why would we want to be doing anything with that company until something more, has come out that determined it's safe or it isn't?
I hear what you're saying, and actually we have to really buckle down in terms of the way that we do Zoom. So we have a password policy, and so there's a password that we do with it. So it's secure because we also use Zoom for our team meetings. And so that information, of course, is HIPAA related. And so, yeah, our company has an account with them. And then also we use a password on top of that. So yeah, we are watching for that, because certainly we don't want anyone listening in, and we can't have that. That would be a violation. So I understand your concern.
Yeah, and by the way, I'm not saying that I know. I just is it something that the cautions that are being placed out there, that maybe it should be something suspended until something definitive is arrived at?
Well, I know with our company that what we did is we did go through a process to make sure the way that we do it is HIPAA compliant. With other companies, I'm not so sure. And again, even with your and I've never had this experience, but they say if you don't cover your camera, that people can even somehow figure out a way to sometimes go in. So I don't know. I'm not a techie, so it's a little bit tough on me. But yeah, I hear what you're saying. And again, technology has that kind of potential.
So my guess is that if it's HIPAA compliant, it's probably pretty secure.
Yeah, we had to go through that before we even started using it.
David?
Yes.
This is Rochelle. Hey, I would just like to say thank you for connecting with my office, because as you know, not all of our veterans in the community are connected to VA healthcare. So it's nice that there's other resources in the community that are reaching out to us to connect with veterans, because not every veteran qualifies for VA healthcare, which limits their access to caregiver programs and to aid in attendance and to other benefits. So it's nice to know that there's other resources and that you guys are doing so much for the veteran community, and I really appreciate it. And I'm looking forward to when COVID ends and we can all go back to normal and we can participate in your outreach programs and get these veterans connected to more benefits as well. Thank you for your presentation tonight as well.
Oh, thank you, but real pleasure. Thank you, and really appreciate the opportunity and the partnership. Thank you, Rochelle.
This is Darrell with the clerk of the board. So Erin, if you wanted to go ahead with your presentation next, we can get your PowerPoint up on the screen here. And when you're ready for the next slide, you just let us know next slide.
Okay, good evening. So did I start? David, are you finished? Okay. Well, good evening, everyone. My name is Erin Saberi. It's an honor to be with you. I wanted to thank Rochelle Arnold for the invitation and all of you for your time. My understanding is we're following in your great footsteps. I am representing the Blue Ribbon Commission on the establishment of a Sacramento County Women's Commission, which was formed to do an inquiry about the viability of a women's commission in Sacramento County. And it was formed in July of 2019. The Board of Supervisors just passed a resolution this month, December 15th, to establish a women's commission. I think you were the commission that preceded us, so we will be the next newbie kid on the block after you. And so in many ways, I'm here tonight to really share that news with you, to learn from you and your experience, but more importantly, to see where the connections are with our work that will start in the new year and your work. And on behalf of women veterans, but also women who we know still carry on principal caretaking role in our culture and are at home with veterans, whether they're veterans or spouses of veterans, daughters of veterans, mothers of veterans. Women are impacted and serve the country and as veterans and as family members of veterans. So we very much want to include your veterans community into our work with the Prospective Women's Commission. And I wanted to just take you through really quickly some slides about where we've been and a little bit of sharing with you kind of the grassroots story of our kind of growth and how we hope to serve the community and the public as a commission and making linkages with government and governmental bodies like yourselves, but throughout the community. But before I do that, I just wanted to pause and, I don't know any of you, and I know everybody starts veterans presentations with telling their linkage to being a veteran or not, or their life. And so I'm not a veteran, but I will share with you that I had the honor of working as a staff member to a member on the Veterans Committee a long time ago. This ages me, when we were fighting the fight to get Agent Orange benefits for veterans. And so I had the honor of working on that bill and also being a close friend of the great former late Lane Evans, who was the champion of Vietnam veterans and Agent Orange. And I learned a lot through that process. And now, of course, we have a lot of different issues, but the same levels of trauma. And we're connected as a Women's Commission to a lot of women's groups that are dealing with trauma in many ways throughout the community. And so it's our hope to link more women to that work and women's veterans. And so I was on the phone today with a woman on our Blue Ribbon Commission who leads just a program called Women's Wisdom Art. And they do all sorts of work with art. And a few years ago, they had an incredible program with some local women veterans, but now they're working with homeless women, and they're working through this angle of art. But there's many other levels through mental health and through art and through, you know the gamut of programs, but there are some specifically directed towards women, and we hope to be able to connect. So I wanted to pause and just see if you have any questions at this stage. So I'm hoping to have a little bit of a dialogue. I know you don't have a lot of time, and I'll run through these slides really quickly, but just wanted to see if you had any questions straight off. Okay, hearing none, I'll proceed. So we gave a report to the Board of Supervisors. We had a year inquiry into women's commissions around the state, what women's commissions do, the viability. There's a great history of women's commissions, about 50 years now in the running, but longer than that on the international level. In 1961, President Kennedy started the first National Women's Commission, and California has had women's commissions since the 70s. Sacramento is one of just a handful, less than a handful, of the largest counties in the state that have not had one. So we presented a report to the board. It basically tells our story of grassroots work and then our recommendations. Next slide. And I'm going to go through these next ones really fast. We've actually recommended a 15-member board. I'd love to have a conversation with you about, you have a 5-member board and how that's working for you. We were thinking of, and ours is just a recommendation, to have each supervisor have 1 member, and then the community would have 7 members so that we have more community engagement, and then 3 youth members. Next slide.
I don't see any slides.
Oh, you don't see any slides?
No, ma'am.
I see them.
Let's see.
Oh, excuse me, found it. Thank you.
Okay. We'll just go through these because I think the role of a commission and whatnot, you all are pretty clear about advising and whatnot. We can move on. We can move the slides. We can go on. Maybe I should probably try to, wonder if I should. So I said our resolution passed on December 15th. Next slide. So really our whole kind of journey began with this question, how are the women and girls? It was just a grassroots group of us asked that question, and we started, next slide, to look at data. And what we found is there's not really a lot of data that is easily accessible. There's a lot of data in government. You might find this with veterans issues too. There's data all around, but the accessibility of data and the compilation of data and having it be understood, that's a whole nother story. And so when we asked the question, how are women and girls doing in Sacramento County, we couldn't really get a clear answer. We had different points of data. Some were contested, some were accurate, some were not known. So we decided to begin listening, and we did over a year of listening to women and girls. We had listening circles, we had events, we had forums. These are just some pictures so you show how to see how dynamic it was. Next slide. Next slide. Oh, there's a few of our women veterans. We have some women veterans in our group. We had community meetings. This is over a year-long process. Next slide. We engaged all of the women's groups. There's so many, but we engaged a lot of the women's groups in towns, the bigger ones. We had listening circles, and these on the right here, you see some, we integrated art component into our listening circles. Next slide. I'm just trying to give you a flavor of what we've done. Next slide. Next slide. So this is just members of our commission, but next slide. Some of these slides. And we had partners from all of these groups, the AUW, WEAVE, I'm sure you've heard of some of these groups that do with homeless women, the League of Women Voters, we had counseling centers, we had women's housing and opportunity, we had Sacramento State, many partnerships throughout the region. And we hope to have a partnership with you. Next slide. Next slide. These are just the activities of our Blue Ribbon Commission. I'm not going to worry your time about that. But here's what we found in listening to women. We found that, although there have been many gains, as we all know, in the last 50 years, there are still huge gaps in terms of equity and in terms of opportunity for women. And we were surprised by some of these, actually. And particularly COVID-19, I know the fellow before talked about how COVID-19 it's affecting all of us. But the data that is known nationally is showing that for women in the workforce, and in many ways, women are being particularly hard hit. Next slide. The top 3 issues that respondents identified, this was from one of our data. We had a few data experts in our group, and this was just from one set of listening, but it actually the thread of issues that people identified kind of rang through all of it, with safety and violence, surprisingly for us, still coming in as the #1 top issue women are concerned about, followed by healthcare and economic well-being, which has a whole host of factors with economic well-being, whether it's job training or access to work, or equal pay. But you see that housing and homelessness came in not too far behind that. We did have a lot of we did surveys, we did listening circles and whatnot. We did have women veterans responding. We're not able to do a listening circle as we had planned with women's veterans because COVID hit in the middle of it. We're still hoping to do that. We did get some women veterans involvement, and we had a couple women veterans on our commission. And some of the issues we've heard from women veterans are also access to health care, even though, I think as Rochelle was saying, not everyone has access to the VA. And also safety and violence issues, as you know, still persist in the military as well. And women veterans still have stories to tell about that. So next slide. I kind of said to you, what is a Women's Commission? It's dedicated to the promotion of gender equity and the empowerment of women, and it advises government as you're advising government on veterans issues. Next slide. I think we can go through these really quickly because I already talked about women's commissions in California today. We just have these in to show a little bit of examples. Next slide. And so this is actually a couple of our women veterans in these pictures here. But we have a website, sacramentoblueribboncommission.com, if you're interested in finding out more about us. But mostly wanted to have a discussion with you, if not tonight, at some point soon when we stand a commission, to really think about how we can help make linkages into the community for women veterans and with you. And maybe we can think of joint hearings together, or something that you want to work on with women and women veterans. But like I say, our mandate will be all women, and we're also very aware that women are also caregiving to our older and ailing veterans, and are part of families of veteran families. So I think there's a lot of opportunity for us to think together about how to meet need and support veterans in our community through the Women's Commission, helping to support your commission, and vice versa. Any questions or comments or thoughts? And also, we're just in the process of standing a commission. You've already done that. We're certainly open to learning from you. We also have just done a very extensive grassroots engagement, and we do feel that one of the advantages we have in forming our commission is that we stand on pretty sturdy ground with having kind of broad support in the community and an extensive community engagement, which I tried to give you just a short sample of. Here are some of the photos of the level of listening and engagement we've done. And so we have some clarity about what issues women want to address, and those were the top 3 issues. I think that COVID has cut through all of our lives, and in many ways, we're thinking that, the impact of COVID, I see that you're going to have a conversation about the impact of COVID on veterans. We're going to be having that same discussion, I think, in the Women's Commission. And of course, we want to hear from you any ways you think that we could intersect with women veterans, and support what some of your goals are with the veterans community. Questions, comments?
So this is Sabrine. Thank you for
Sorry, go ahead, Sabrine.
Okay, sorry. Do you want to go ahead?
Hi, Sabrine.
Okay. So thank you for presenting. I had no idea this was taking place, so I'm just curious, how did you publicize to be able to get women to come and do, I think you called it the women circles?
Yeah. Well, we were very grassroots group. First, it was a volunteer group, and we just started through women's organizations, and we contacted everyone we could, and those who responded, great. And we held meetings. We held community meetings in women's organizations and at Women's Empowerment and at the Girl Scouts and at Weave. And then we had this Blue Ribbon Commission formed, and just as we were beginning a lot of that and going to do listening circles, we had plans to get out to women's groups all over. COVID hit. So we had our first meeting in December of last year. We had a meeting in January and February. Our listening circles were just about to launch in March, and COVID hit. So we had to the listening that you'd seen was kind of before all that in the grassroots group. So we had to then go to a survey format, and we had a youth listening circle by Zoom, and we had a countywide forum. But we did, we have a list of about, 350 people that we've developed over time and through women's groups. And we have a whole long list of folks. I have a whole file here of engagement that we haven't yet gotten to and that we still need to get to. We got hit like everyone else did by COVID, but there are still people who don't know about us like yourself, and that we need to be doing that. And, we're not yet a commission. So we had just a Blue Ribbon Commission. Our mandate was to do research about women's commissions, but we thought it was also important to engage in the community and do listening to the extent that we could during COVID. So in many ways, we've done a lot, and in other ways, we're just at the beginning. We haven't yet stood the commission. So we'll be at the beginning and wanting to, I imagine that the Women's Commission, once it gets formed, let me say we're hoping we'll want to continue this model of doing deep listening and engagement so that we're advising through being connected to the community. And so that's where my hope would be. And I think the women who've been doing this so far, who were on the Blue Ribbon Commission, are committed to, we've made our recommendations in our report for the commission to continue along those lines. And my hope would be that we would be able to do some deep listening with women veterans very soon. I don't know if I answered your question, Sabrine.
You did. I think, I don't know, maybe if the other members agree, but it sounds like you guys really had a different outlook. I don't know that we had a few meetings and then COVID hit as well. So it's been a huge challenge to let veterans in the community know that we even exist. So I really look forward to partnering and, maybe using the same kind of platforms that you guys are using to communicate with the community.
Yeah, it's really a challenge, and we had a challenge. I mean, I think that on the one hand, we had a little bit of flexibility because we weren't yet official like you are. And so, like I understand the problems with Zoom, but we were able to use Zoom, which seems to be kind of a friendlier platform, although the security issues I understand. So we were able to have some flexibility, and we were able to start our own website. And I don't know if as a commission we'll be able to do that kind of thing, but I think that the model of engaging and listening to the community, although it was stifled by COVID, I mean, we were committed to continuing it in whatever way we could. So we did this kind of mixture. We have a survey on our website, but it's hard. I mean, people aren't just going to come to your website and take a survey unless they hear from you, right? So, but I'm glad to speak with you, again, or offline to talk more about that and how we might think together about that. Because we too wanted to be in touch with women veterans, and some of it was capacity too, because we ran out of capacity because we had to also research and deliver this report. But as a Women's Commission, we'll be able to set, the agenda and be able to do more of that. So really looking forward to working with you.
Thank you.
Thank you. And I always like to say to the gentleman, I just want to say to all of the gentlemen, the Women's Commission is never intended to be exclusive. There have been men on women's commissions actually throughout the state of California, but we like to say that, it lifts all boats. And when women are lifted up, the entire community is lifted up. So we really believe that. And so I want to shout out to the guys here. Sorry, Rochelle, go ahead.
Oh, that's okay. This is Rochelle. I just wanted to say thank you for getting in touch with me because like Sabrina, I didn't know this was going on as well. I don't live in Sacramento County, so sometimes activities that are going on like this, go past what I do during the day. But, you and I had a conversation about women's veterans issues related to their health care, how challenging that can be. Even, I spend a lot of time out at Mather on that campus and at the hospital, and the women's clinic is so very small compared to the rest of the hospital, and there's limited services that they don't have to outsource for or give community referrals for. And then the whole issue of military sexual assault, although it happens to both males and females, it seems to be that we have quite a few females that are reporting sexual assault cases and that are filing claims now for it, and they're being founded. So there's a lot of issues, and even the face of homeless veterans is changing to include more women and women with children that maybe don't qualify for, the other services because maybe they're not quite homeless or couch surfing and whatnot. So I'm actually looking really forward to see how the Veterans Advisory Commission and the Women's Commission can work together to maybe address some of these specific issues for our female veterans as well as the overall women's population in the county.
Thanks, Rochelle. And we actually have a great model for that at the state level. The State Commission on Women and the State Department of Veterans Affairs, they've worked together over the years, not this last year, but in years past. They've done an annual report on how women veterans in California. And it's been quite a helpful report to a lot of folks. And just, having somebody do the research, as you say, Rochelle, there's a lot that's still just not known. I mean, we're still living in a world where women veterans are new, pretty recent. And there's just, the systems aren't set up yet in ways. And so it takes time. These things take time, but they also take listening in terms of what's needed, right? And where the system that has been set for one way needs to be, recalibrated here and there. So we're really committed to doing some of that listening and supporting. And if we can do it together, we'd be delighted. And also just wanting to learn more from you about what your goals are in 2021 is what, and we should maybe, I think once we get a commission, follow each other's meetings maybe, or have a liaison. Maybe we can think about something like that so that we're connected, or we connect through Rochelle or somehow so that we're aware of what your priorities are and if we can help advance them. I always believe that government, working together symbiotically is more helpful than working apart in different lanes. So if we can find the places of overlap would be terrific. So are you guys, can I just ask you a question in terms of a 5-member commission? How are you finding that? Some people have said to us that they thought our 15 might be too big. So do you find that 5 works just well? I don't want to put you on the spot, but I'm just curious as we're looking to stand our commission. You're the newest commission. Are there anything you can tell us about size or road bumps or whatnot that you think we should avoid or think about?
I think 15 seems like a high, this is Sabrine, seems like a high number, just the coordination piece and all of that, right? Like we're all volunteers, so we all have full-time jobs.
Right.
So I don't know. I think 15 is high, but I like that you have the community members' involvement, that's what you're thinking of. So I don't know if anybody else wants to weigh that.
This is Member Wrigglesworth. I
Hi.
think you'll probably have a lot more success because we're just trying to reach one portion of the community. That's veterans and veterans organizations. You're trying to reach a much broader personnel. You know, you're trying to reach all the women in Sacramento County. So that definitely opens up your door quite a bit more, and I wish you the best of success with that. But I really do. Because with veterans, it's pretty tough because everybody wants to help veterans, but there's not a lot of people saying, okay, this is how we do it, or this is what we want. You know, they're not saying what the shortfalls are. Because I've asked, and it's pretty tough. Veterans are pretty closed-mouthed. They're good with what they got most of the time, and there's not a lot of wants.
Right.
If they are, they keep them to themselves. So with that being said, I do think you'll have lots of success in your venture. So I wish you the best.
Yeah, thank you. Yeah, I hear what you're saying about the difference in the groups, you know, with the challenge you have. Veterans aren't ones to be out there with their needs, but and I think that's part of the challenge I think we'll have with wanting to work with you to listen to women's veterans too is, you know, how do we keep an invitation open in a way that folks feel is meaningful for them, right? And real for their lives and what their need is.
If you get an opportunity, I would reach out to your local vet center. There's one off of 1111 Howe Avenue, and there's another one over in Citrus Heights, and I think it's off of Greenback. I could be mistaken, but yeah, check out your local
Sunrise Boulevard.
And talk to them as well.
Okay, that's helpful, Mr. Wrigglesworth. Thank you. Appreciate that. Anyone else? Well, I appreciate your time. I know it's holiday time, and you're all like Sabine says, everybody's working. So thank you for taking the time to meet me and introduce, and I hope that it's the beginning of some good dialogue between our two commissions.
Thanks, Erin.
Happy New Year. Thanks for your show.
Thank
Bye.
you. Bye-bye.
And this is Darrell with the clerk of the board. And I just wanted to make note that from item 1, there was no public comment, and there's also no public comment for item 2. So if you're ready, we can move on to 3.
Thank you. You may proceed.
Thank you. So item number 3 is going to be an update on the impact of COVID on veterans.
Hi, this is Rochelle. So I guess I'll start out on this one. I just wanted to kind of
Rochelle,
figure out from the community what was going on with COVID. But as far as to my knowledge, most of the veteran service organizations and Mather, as far as that veterans hallway on Mather where they help with claims where the veteran service organizations are, is still closed to my knowledge. So it's definitely having an impact on people coming to our office. We're actually starting to get people showing up in person to our office. And we unfortunately have to tell them, hey, we're not open, but we try to help them outside of the building. And we're still helping people via phone and internet and things like that. So I guess doing the outreach in the community, because that's where our impact really is being out and connecting our veterans. You know, doing that outreach at the schools, at the vet centers, at the hospital, at the hospice homes, and we're not doing that right now. So it's definitely having an impact on our ability to connect with our veterans. And I was just kind of curious as to what you guys are seeing on your end with COVID and how that's impacting our veterans.
This is Member Wrigglesworth. Rochelle, like all our clients that we have for Veterans Treatment Court. I know a lot of services are still being provided via Zoom for their meetings and stuff. So that's really good. The VA is doing a lot of their counselings and psychiatry visits are all Zoom meetings now, and even their arts meetings and other forms of therapy. They're doing it all by Zoom meetings and or by phone calls. So that's one good thing that's been going on with the VA is they have still continued a lot of the services through either phone or Zoom. So no more comments.
That's definitely a positive because I know the vet centers were doing things remotely for a little bit, and I've had some veterans that stopped going to counseling because they felt that the telehealth appointments were just not effective for them. So, and they're the ones that need to be in those sessions, and they're not going. So it's definitely having an impact on mental health for our veterans as well. And yeah, we're doing what we can. The VA, as far as disability appointments, they've started doing them in person again, so we're not having to wait as long to get claims decided. We put in a claim for a veteran and it was back within a month. So they're turning them around super fast, which is good because that's putting money in veterans' pockets. But I'm concerned a little bit about how it's impacting mental health and access to other resources for our vets too.
So I don't know if this was on. Go ahead.
I'm sorry. I would definitely say that the fact that a lot of these people, isolation isn't really good for them to begin with because that's their go-to. But yeah, I think you're correct on having an impact on the mental well-being of our veterans. Not being able to do more face-to-face and self-isolating. So I agree with you on that note.
Maybe if you guys can brainstorm, I don't know if you guys have any ideas being veterans yourselves, but how do we combat that during a time like what do you think would be effective on, I mean, we don't have to answer this tonight, but that would be something that maybe we can take as a challenge is how do we reach out to these veterans who are isolated during COVID, maybe through that Veterans Cafe, the virtual meetings, and maybe starting something within the county via the Blue Jeans app or something for them. We're in the process of updating our website and things like that, so maybe we can post some videos and have a meet. I do a meet with the CVSO once a month at the library, which is on a virtual platform, so that's a way that veterans could come together and ask questions and get information about claims and other questions that they have answered as well, but kind of brainstorm and come up with how we can impact those veterans and maybe just give them the resources that they need, if they're not aware. Does anyone else have anything or any questions about the impact of COVID or any suggestions?
So this is Sabrine. I don't know if the health side is doing it, but I know for the dental side, like I know when I went to the dental clinic a few weeks ago, my dentist said, normally if they can't get you in, you have to wait the 30 days or right. If it's past 30 days, then they refer you out. But he said like right now, if they can't get you in, they refer you out right away. So I don't know if there's any, providers for mental health on the outside that are seeing patients face to face because not everybody is doing Zoom, right? Like there's some people that are still doing in-office sessions just for that reason that it doesn't work for everybody. So I don't know if the VA is doing strictly Zoom or telehealth, but I mean, that's kind of scary that there's people who need that therapy and, you know, potentially aren't getting it. So.
Sabrina, this is Dale. I can tell you for the mental health, like appointments, those are all just phone calls.
Yeah.
I know the vet centers were meeting outside, doing like groups outside with social distancing and whatnot, which I thought was a little bit awkward, but at the same time good for the veterans to still see each other face to face. But I don't know if they're doing that now with the cases that have risen after Thanksgiving and whatnot. So, but I think they were trying to go back to doing smaller groups, but I don't know if they're actually, I'll have to reach out to them, but I'm not sure if they're actually open or if they're still doing telehealth and telephone appointments.
So I would just add any engagement is better than no engagement. So virtual engagement is certainly not as good as face-to-face, but it's better than nothing. And yeah, if they can do something in person, that's great. But I would encourage to continue virtual services in the meantime.
That's all I had. I don't know if anybody else has any questions or concerns or comments on the impact of COVID on veterans, if there's anything from the community or not.
This is Darrell with the clerk of the board. We do not have any public comment for item number 3.
Oh, my bad. Sorry.
Oh, no, you're fine. I was going to make that announcement anyway. Okay, Chairperson Banks, would you like to move on to item number 4?
We can.
Perfect. So item number 4 is going to be an update from Sacramento County Veteran Services Officer.
That would be me. So I had some materials. I don't know. But speaking of impact of COVID on what we're doing, for November, our number of claims were down to 83. So for July through November, we were at 791 total workload units, which is essentially everything that we get credit for filing in the office. However, in looking at how many total dollars awarded monthly, we're still putting money in our veterans' pockets. We were at $344,579 for the year as of November. Through today, I just pulled the numbers, and for December right now, we've brought in $20,145.10, which would bring our total for the year to $364,724. That goes right into our veterans' pockets in the county. And then for our total compounded monthly payments, we put in our veterans' pockets so far $2,854,072. With December's total, if it doesn't go up anymore, we would be at $2,874,217. And then for our total retro and lump sum dollars, which is when the veteran files the claim, it goes back to the date that they filed that intent to file, or sometimes they file their original claim and then they file a supplemental, and it's still valid within the year as long as they file that supplemental before that 1 year mark. So right now, through November, we were at $1,216 that we brought into our veterans' pockets in total lump sum and retro dollars. For December, I just totaled it up, and we were closed out $233,245.86 in retro payments to our veterans for the month, which brings our total for the year, as long as that stays the same, to over $2,109,000 $109,461 for the year. So we are still putting money into our veterans' pockets, which is a good thing. And for our 6-month period, because we're almost closed out. So last year we were at 215 workload units, which is basically the claims that we file. This year for the same 6-month period, we're at 215. Last year we were at 222. So it's only a difference of 7 workload units. So we're still helping our veterans despite our lobby being closed. We're still reaching out to them via phone, email, however we can get a hold of them, and they are filing claims. So my vet reps are doing a lot of good work to try to still connect our veterans to their benefits. This chart right here is our total revenue that we brought in. So this runs from July 1st of 2019 through June 30th of 2020. So it's our fiscal year for the county. So we brought in a total revenue with all 3 of our funding sources of, because I can't read my tiny little screen, $135,601 was brought into the county by our work. So that is more money than we brought in, as you can see, the last several years in that office. And what we're working on right now should exponentially increase that. We're working on a process to automate our Medi-Cal veteran welfare referral forms, which when a veteran goes into a welfare office and applies for a Medi-Cal or CalFresh benefit, intake worker is supposed to refer them to our office so we can then connect them to their federal VA benefits if they're eligible. So that we're going to automate that process, so then that eliminates the customer or the veteran having to run back and forth to get a form signed and filled out. So that intake worker will then be able to just create an automatic referral, which will get sent to our office. We validate it, then they're not held up on their benefit side with the county. And then in turn, we can have them fill out a healthcare form and get them enrolled in VA healthcare and get them connected to any potential disability benefits or pension benefits that they may qualify for on that side. So that should exponentially increase our Medi-Cal cost avoidance, which I'm very hopeful. And then I have some goals for 2021 and probably working on a 3 to 5 year strategic plan on what could the Veteran Service Office for Sacramento look like. Could we move to a location potentially where we have wraparound services for our veterans? So that's all like in my brain, and I'm working with my leadership to first expand and grow our office where we are, bringing in new processes and working to generate more funds into the office. And then we can talk about potentially like what could the Veteran Service Office look like if we're successful in doing that. So I hate COVID, it sucks. Sorry for that, but it does because it really limits our outreach and what we're able to do. And it kind of dampened a little bit of my momentum getting back out into the community and finding our veterans. So, but we're still here, we're still doing good work, and we're connecting our veterans to their benefits, which is the most important thing that we do. So that's all I have. Do you guys have any questions for me?
So is
Are you guys still 100% telework?
I'm sorry?
Are you guys still 100% telework?
So myself and my clerical staff are in the office every day, and then I have a couple of vet reps that alternate work from home and in person. There's still one out on leave, and then my 2 other ones, the majority of the time they're doing telework.
Okay.
So, but do any customers come to the office?
So we have had some show up at the office, and some of them are just dropping off papers. One of them was my leads veteran who she was working with and now wanted to file for an increase to his benefits, and was not aware that she was out on parental leave and things like that. So we took all of his info. We still try to help them when they come to the office, but we're limited on being able to allow them into the building. So a lot of the stuff that we do is either at the door or right in that front lobby, however we can help them there. I've done driver's license forms and talked to veterans outside, but I have to be very careful about letting them in the building right now because of the county's public health order. I have to follow that. So. You guys have any other questions for me?
No, I have a question for Danielle.
Danielle.
Or Danelle.
Darrell with the clerk of the board? Yes.
Excuse me, Darrell. I'm sorry.
No
So
problem.
trying to understand, I'm looking at this thing with presenters. I see 4 blue things with participants. I'm trying to understand who's privy to what we're discussing now.
So right now, people that are logging in to watch the meeting, members of the public can view this meeting.
Okay.
And then the members, everyone that has the information. Now there's different levels of access to the meeting. So the public only has access to hear what's going on and to be able to call in to be able to make a public comment. And they have access to the material that was posted on the website. Now, members and people that are making presentations, they have a different login where they're able to present their screen, or they're able to control their video and their microphone.
So when are we going to close the public aspect of this so we could just talk among ourselves? Or are we?
You wouldn't be, because everything is public, so you wouldn't be talking amongst yourselves. I mean, I'm not sure what you mean by that. You mean just...
Well, are we going to have any comment on what Ms. Sabreri was speaking and offering?
So you would be making that comment now. I don't know that there would be anything that would be off the record that's not privy to the public.
Okay,
Hello,
so
I'm sorry. This is Alma from the clerk of the board's office, and this is an open public meeting, so there would be no closed session unless you actually had a legal closed session. But this meeting is completely open to the public, and any comments would be recorded and be part of the record. That's part of the public meeting process.
okay, I think I understand. Go ahead.
John, this is Wrigglesworth. Read your bylaws. We can't have sidebars.
Well, and okay, that's fine. I'm just so with this thing that Ms. Sabreri proposed with this partnering up and all of that. Are we going to discuss whether we condone that or, don't condone it? Is that something we would do?
You can make that comment now. It's been agendized for presentation. However, if you want to discuss it further with the members, we could agendize it, in the future. But since it was on the agenda, you could make the comments during the comments from the members. Now, you wouldn't want to take a vote or anything on anything, but you could make a comment about how you feel about that process.
Well, okay, and I respect with what Ms. Sabreri with her presentation. I thought it was very good, but I would not be in favor of endorsing anything that was gender specific, race specific, anything that has to do with divisive agendas. And I feel on the face of it, that one's very divisive, in my opinion.
Okay, and I will take down your comments and I'll note them down here.
Thank you.
You're welcome. And just while I have everyone's attention, this is Darrell again with the clerk of the board. There was no public comment for item number 4. And Chair, if you're ready, I can move on to the next item.
Yes, please.
Okay, so item number 5 is going to be comments from the members.
This is Rigglesworth. I have no comments.
Member Rochelle, one thing that I think that's has come up recently with the things that I'm dealing with that might be a consideration that is specific to veterans. I've been assisting certain different groups out there. As we talked before, there's so many different groups trying to help veterans, but I think there's something that needs to be addressed or considered to be maybe within our purview, and that is where I'm helping certain veterans with certain legal matters. And I'm talking about legal matters where they may be being denied in this one particular matter that I'm involved with. A veteran who is a disabled veteran, and he is involved with a warranty issue on one of those Tempur-Pedic beds, that they advertise. They're very expensive. I didn't realize how expensive they are. I guess when you buy the whole platform, the bed, the whole 9 yards. But he's a disabled veteran. He spends all his time in bed, unfortunately, because of his condition. And he's had an issue where the bed has failed. And going through the property warranty procedures, what he thought was, the way to go, and using a veteran, I think it's a VFW or whatever, to help him, they are, denying anything. Well, I can tell you from my particular trade that it's BS, and I'm attempting to help them the best I can with having to know how to navigate civil matters, and I think that's something that might be beneficial to our group, where we are specific about it dealing with a veteran and helping them when they're out there seeming lost, not knowing how to approach us. They can't afford an attorney. There's not a lot of attorneys out there that want to take this stuff pro bono. But it's something I will tell you that can be beneficial with the knowing how to navigate the system, and that I do know. So it's something that we haven't talked much about because we always seem to be dealing with health benefits or claims and things like that. But there's another frontier out there, which is being able to help veterans that might need a legal assistance, and just feel somewhat lost. So I'm just throwing that out there for you.
Does the office have any means for legal assistance?
I've actually had veterans reach out to us, and that's a very personal decision to hire an attorney. We don't generally make recommendations to private attorneys. There's an attorney that works for an advisor for the California Association of County Veteran Service Officers, and she used to represent veterans at the Board of Veterans Appeals, but that's a very specific job that she had related to disability claims and denials of those. It's not for civil or other legal issues. So, I have no idea about how to go about recommending an attorney to a veteran. I think that's something that they would have to research and look, because that's paying somebody money to do something, provide a service, and I don't want to get involved in making recommendations and then be unhappy. So we really haven't gotten into that.
That's not what I'm talking about, and I understand what you're saying, but let me tell you, there's a need where I think we could help, and I'm not saying picking an attorney or whatever. I'm talking about how to navigate it, which I do know how. And there are, if the facts are sufficient, there are attorneys out there that will take these types of cases, and they will take them on a contingency. This whole idea that, because it might be a personal veterans matter, well, of course, everything that you deal with is personal. And I'm just suggesting out there that I'm not talking about for claims and, standing in front of some type of a board to determine their, rights to claims or whatever. But I'm talking about, I will tell you, it would not, or at least I think it would be a benefit to offer them some guidance. For instance, I'll give you probably the most common that I deal with. And by the way, I'm normally a defense counsel in these matters. But for instance, veterans that have issues with automobile sales and breach of warranty matters. And they may not know how to go about navigating. And I don't have any problem myself with helping them to say, look, this is how you go about it. And obviously, in the end, it's always their choice if they decide to go to litigation, that they select whoever they want. But I will tell you, there's statutes out there that protect consumers. They're called consumer protection statutes. And I'm just saying I'd like to narrow it down where maybe this commission could offer a benefit to the veteran to explain to him what he's entitled to. And there are plenty of trial lawyers out there that will take certain cases and they take them on a contingency where it doesn't cost the veteran any money, and yet he can have his day in court, so to speak, if the things like denying warranty and things like this, where they get very frustrated. Because I will tell you unequivocally, whether you have a service contract that you bought on your car, or you have a warranty issue with the manufacturer you bought it from, they inevitably deny claims all the time. And their whole thing behind that is they know that once they deny something, 80% of the people drop off. And then it's only the 20% left that maybe continue doing it. And the only thing I'm talking about or explaining this to you is because I'm dealing now with a disabled veteran and trying to help him navigate the system. Well, I think it'd be nice if they somehow knew that we can help them with this, because it's a jungle out there when it comes to trying to know how to navigate this.
John, I'm not going to disagree with you. However, I think this is kind of a very specific issue that you probably deal with on a regular because of your profession. I can tell you our office does not get many phone calls for trying to help with litigation in civil matters. So, I mean, if you want to provide us with a network of attorneys who will take cases for veterans, if we do on the off chance of those phone calls, I'll be happy to provide it for them. But we really don't get a lot of those phone calls in my office. I think attorneys probably get a lot of those phone calls, but I don't think the percentage of what we deal with from the veterans in the community has to do with those types of matters.
Just offering it out there.
Does anybody else have anything?
This is Darrell with the clerk of the board. There is no public comment for item number 5. And if you're ready, I can move on to item number 6.
Please proceed.
Okay, and then item number 6 is comments from the public. We do not have any public comment at this time. So, and let me just double check again. Yes, no public comment. So if you like, you guys can adjourn if there's no other comments from the members.
Okay, can I get a motion to adjourn, please?
I will make that motion.
I will second it.
Okay, so our meeting is over at 7:37 p.m.
Happy New Year to everybody. Stay safe.
Happy New Year to you all.
Happy New Year.
You guys have a nice evening.
Thank you, everyone.
Thanks.